everyone. I just want to talk a little bit about our week 4 quiz. So I'm going to apologize. I have to look down at my notes, but I'm going to take a little bit of a different approach this week since the way we've been doing it's kind of boring. So we're going to try a different approach. So I'm going to talk a little bit about the quiz questions that were most missed, but I will ask that you still, if you didn't miss one of these, please take a look to see whichever one that you may have missed. If you didn't miss any, great. Congrats, great work. But if you did happen to miss one that's not one we'll go over, please go ahead and take a look in the text to find that. So the one that was most missed across all of the students this week, the question was, to ensure quality, Medicare prefers accreditation through which agency? Our potential answers were U.S. Department of Health and Human Services, Centers for Medicare and Medicaid Services, U.S. Department of Labor, or the Joint Commission. So all of those agencies are involved with healthcare organizations in one way or another, but the Joint Commission is that agency that most hospitals are going to receive accreditation through, and actually it's the U.S. Department of Health and Human Services and Medicare, Center for Medicare and Medicaid Services, that actually prefers that Joint Commission accreditation that is most important. They do accept, there's several accrediting agencies that they accept, so it's not necessarily maybe that they prefer them, but none of those other agencies on that page are accrediting agencies, so they are government agencies. So Joint Commission was our answer for that one. Next question, resource-based relative value systems reimburse what for services provided to Medicare beneficiaries? So our options were physicians, hospitals, ambulatory surgery centers, or home health agencies. So resource-based relative value, which is RBRV, the resource-based relative value scale, RBRVS, is a specific type of payment system. You also may hear it referred to as RVUs, relative value units, and that's what the physician fee schedule, Medicare physician fee schedule, is built on. So our answer in this case was physicians. So our Medicare physician fee schedule, and actually many physician fee schedules across commercial payers as well, based on that resource-based relative value scale, which is a combination of physician work, malpractice, and overhead, kind of a practice expense, which is a combination of overhead expenses, kind of lights, heat, power, everything that goes into overhead, staffing, all of that kind of stuff. So that is our answer there. Next question, why are healthcare expenditures disproportionately higher for people age 65 and older? So our possible answers, this population utilizes a significant amount of services. Elderly people tend to have more chronic illnesses. This population uses healthcare services at a much higher rate than the population under 65 does, or all of the above. So that is our answer, all of the above. So all of those things. That population uses more services, they tend to have more chronic illnesses, and they use them at a much higher rate. So more services at a much higher rate, and they tend to be a sicker population. So our answer for that question was all of the above. Next question, fourth one, the donut hole as created by Medicare Part D refers to what? So a certain prescriptions that are not listed on the formulary for Medicare, the concept that more generic drugs than brand name drugs are covered under Part D, the gap in coverage between drugs on and off the Medicare formulary, or a gap in coverage requiring beneficiaries to pay out of pocket for prescription drug costs that fall between a certain cost range. So that last one, the donut hole, so Medicare Part D is our Medicare prescription drug program. So remember, Medicare is the program for our elderly population, folks over 65 typically, although it does cover patients with end-stage renal disease, as well as certain disabled folks in our population. And Medicare Part D is the Medicare prescription drug program. But it does have this thing that's called the donut hole. So Part D covers drugs up to a certain point, and then stops covering them for a while, and then covers them again. So there's this gap, this big gap, kind of like the hole in a donut. So you eat part of it, you get to the hole in the middle, and then you eat the other half. This donut hole is this gap in coverage that unfortunately people on Medicare have if they have the Part D drug program, and that's what this donut hole is like, this gap in coverage where folks with Medicare are forced to pay out of pocket. And even with Part D, drugs can be expensive. With this donut hole, it gets a whole lot more expensive for them. So the donut hole is very difficult and something that many have tried to fix over the years since the Part D drug program has come into place. The last question, the anti-kickback law prohibits what? So the options were upcoding and other acts of fraud, physicians from referring patients to and other physicians in a specified area, anyone from accepting any type of financial arrangement to induce referrals, or physicians from referring patients to an organization in which they have a vested financial interest. So the anti-kickback law is, our answer is that it prohibits anyone from accepting any type of financial arrangement to induce referrals. So when you think about the kickback law, think about bribes. That's kind of, I think kickback, I think bribes. And that's kind of what that is. An inducement is like a bribe for that referral. So you can't get a kickback. You can't get money back for referring a patient somewhere. That's considered a bribe. So these types of laws, Stark law, anti-kickback law, those are important compliance regulations, compliance laws to be aware of. That first answer, which was the one that was chosen most frequently, that was incorrect, the answer upcoding and other acts of fraud. When you think about upcoding or unbundling or inappropriate documentation for any particular type of a service, that's often what we think about when we think of fraud and abuse in Medicare or Medicaid. That is the False Claims Act. So that's probably one of the other popular, if you want to talk about popular, when we talk about laws, and I guess they're not really popular, but when you talk about a type of popular compliance regulation or law, the False Claims Act is the one that is invoked when we talk about upcoding or inappropriate documentation, lack of documentation for billing and coding, those types of things. So those were our 5 questions, and what we will have and what you have had throughout this, hopefully if this has worked out okay, are some questions to answer through the Edpuzzle program. If this works out well this week, this is probably what we'll be doing. It's a little more interactive than just simply, yes, I've reviewed my quiz, and hopefully a little bit more fun. But any questions on any of the quiz questions or any of the material from this week, please just let me know. Thanks so much.